the real world evidence for GLP-1s can be quite different from the clinical trial evidence. I mean, it's not a thing that this is something that is relatively well understood, generally speaking. But I think it's especially true when you're looking at drugs for weight loss, right? Like the targets in the trials were to have, sustained weight loss and, oftentimes for cardiovascular benefit. If you think about how these drugs are actually used in practice, a lot of times people are trying to use these to drop, let's say, 10, 15 pounds in advance of, a wedding or something else like that, that can be a bit more sort of temporal. They hit that target weight and then they discontinue. I mean, it's just people tend to have a different approach to weight loss medications than what you would see in a clinical trial. And so when you take that and you look at this in a real world setting, we see that adherence and persistence to these products is quite poor. If you're looking at members who are new started on any drugs, you would be sort of probably surprised how low adherence and persistence is, but these are much sort of below expectations. We see, in that first year, the majority of members did not continue the product for that entire first year. And if you look out to the second year, members who initiated in 2021, we're only seeing overall adherence and persistence at like 15%, which is really, really low. So you're only seeing about 1 in 6 members continuing these products for a full 2 years, which is really, really different than what you see in clinical trials, which is about 85% or so. And so that, of course, has implications on the benefits that you're going to see from these medications.